I want to tell you about something I discovered that sounds completely unremarkable. It's not flashy. There are no machines. There's no app. There's no app sending you notifications. It's not something that looks impressive when you're doing it. In fact, someone watching you would think you're just standing there. But what this simple position does to your body after age 50. It's profound. Let me ask you directly, are you struggling with any of these things? Your knees hurt when you stand too long. You can't get up from a chair without using your hands. You're losing confidence in your balance. Your energy dips in the afternoon. You're not feeling like yourself. You know something's off, but you can't quite name it. I'm going to show you exactly what's happening in your body. And more importantly, I'm going to show you how to fix it with something so simple that you'll be skeptical at first. It's called the horse stance. And yes, it can take less than 2 minutes a day. But here's what I need you to understand before we go further, this isn't clickbait. I'm not going to tell you it's a miracle cure. What I'm going to do is walk you through the actual science, show you exactly how to do this, and explain why it works specifically for your aging body. By the end of this video, you're going to know whether this is for you or not. Welcome back. And on this channel, we focus on one thing, helping people over 50 move through life with strength and independence. Not the Instagram fitness kind of strength. Real strength. The kind that lets you pick things up off the ground without wincing. The kind that lets you stand through a family dinner without your legs aching. The kind that makes you feel like yourself again. In the next 20 minutes, I'm going to walk you through something important. First, we're going to look at why the standard fitness advice fails people over 50. And I mean actually fails. Not fails to be optimal, fails to be safe. Second, I'm going to explain exactly what the horse stance is and why martial artists have been using it for over 1,000 years. Not because it looks cool. Because it works. Third, we're going to go through the actual science. Not hype. Real research from real universities showing what this simple position does to your muscles, your joints, your balance, your hormones, and yes, even your sexual function. We're going to talk about that openly because it matters. Fourth, I'm going to show you exactly how to do this with proper form. Because form matters. Bad form will hurt you. Good form will transform you. And finally, I'm going to give you a real plan that fits into your actual life, not some idealized version of your life that doesn't exist. But before we go deeper, if you're watching this and you find this valuable, I'd genuinely appreciate if you subscribed. It helps us reach more people who need this information. Let me paint you a picture of what's actually happening inside your body right now if you're over 50. Starting around age 30, your body begins losing muscle mass. This isn't theoretical. It's measurable. You lose approximately 3 to 5% of your muscle mass every single decade. Most people don't notice this in their 30s and 40s because you're still doing activities that maintain your strength. But at 50, the acceleration is real. And if you're not doing anything intentional to counteract it, by the time you hit 60 or 65, you've already lost a significant portion of functional strength. But here's what's worse than just losing muscle, your body loses it in specific places. Particularly in your legs. Your quadriceps, your glutes, your calf muscles, these decline faster than your upper body. This isn't random. This is because you're sitting more. Your legs aren't being challenged the way they were when you were younger and more active. The consequences are real. They're not hypothetical. According to research from the National Institute on Aging, people over 65 who have weak legs have a 60% higher risk of falling in the next year. Falls are the leading cause of injury-related death for people over 65. Not car accidents. Not disease. Falls. This isn't me trying to scare you. This is context for why this matters. Your joints have also changed. The cartilage that cushions your bones, it's thinner now than it was when you were 25. Your synovial fluid, the lubricant in your joints, is less abundant. Inflammation is higher throughout your body. So when you do high-impact exercise, running, jumping, heavy weightlifting, your joints pay a price. And your nervous system has changed too. Your balance isn't what it was. Your proprioception, your sense of where your body is in space, has declined. Your reaction time is slower. All of these combine to make falls more likely and injuries more severe. Most people respond to this by doing less. They stop moving. They become more sedentary. And this actually accelerates all the problems I just described. This is the trap most people over 50 fall into. Here's the truth that the fitness industry doesn't want you to know: most exercise programs are designed for 25-year-old bodies. They're designed by younger trainers. They're tested on younger populations. And they're sold to older people with the assumption that age is irrelevant. It's not irrelevant. It's foundational. When you do high-intensity interval training, you're creating a stress response in your body. That's fine at 25. Your recovery systems are robust. Your joints are resilient. Your nervous system can handle it. At 55, that same high-intensity work creates a stress response that takes longer to recover from. Your joints pay a price. Your nervous system gets taxed. And if you're doing this 3 or 4 times a week, you're not recovering between sessions. You're accumulating damage. Heavy weightlifting has the same problem. Lifting a weight heavily enough to trigger muscle growth requires putting your joints under significant stress. The muscle can handle it. The joints, after 50, often can't handle it at the frequency and intensity that would be needed to see real results. And complex movement routines? They fail because of something simpler than you might think: they're hard to do consistently. A 45-minute gym routine with 12 different exercises requires time, motivation, a gym, equipment, and enough variation that it stays interesting. Most people over 50 are busy. You have work, family, grandkids, responsibilities. A 45-minute routine becomes unsustainable within weeks. So you quit. And then you feel like you failed. But you didn't fail. The program failed you. What if I told you there's a completely different approach to building strength? Not faster. Not flashier. But more effective for your aging body and infinitely more sustainable. It's called isometric training. Isometric means same length. Your muscles are working hard, they're under tension, but they're not changing length. You're not moving. You're just holding. This is fundamentally different from what most people think exercise is. When you do a bicep curl, you're doing what's called concentric and eccentric work. The muscle shortens, concentric, and lengthens, eccentric. This is dynamic. It's movement-based. With isometric work, the muscle is under tension the entire time, but it's not changing length. Your body is recruiting muscle fibers intensely, but you're not creating the joint stress that comes with repetitive motion. Here's what the research shows, and this is important. A study published in the Journal of Applied Physiology in 2016 compared isometric training to dynamic training in adults over 55. The isometric group held positions for 30 seconds. The dynamic group did continuous movements. After 8 weeks, the isometric group gained muscle strength comparably to the dynamic group, but with significantly less joint stress and significantly fewer injuries. Let me say that again: same strength gains. Less joint damage. Fewer injuries. Another study in the European Journal of Applied Physiology looked specifically at muscle endurance in people over 60. The isometric group improved their endurance by 58% over 12 weeks. That's enormous. But here's the part that really matters: isometric training has a unique effect on tendons and ligaments. These connective tissues don't get as much attention in fitness conversations, but they're actually more important for longevity than raw muscle strength. A study in the Journal of Orthopedic Research found that isometric training increased tendon strength by up to 35%. This isn't theoretical: stronger tendons and ligaments mean more resilient joints. They mean fewer injuries. They mean better function in real life. The horse stance is essentially a perfect isometric exercise for people over 50. It's a single position that works multiple muscle groups simultaneously without repetitive motion and without heavy loading that risks injury. 730 to 1300 hours, Chapter 2, The Benefits, Extended and Deeper. I'm going to walk you through each benefit. Not quickly. I want you to actually understand what's happening in your body. When you hold the horse stance, something specific happens. Your quadriceps, the large muscle on the front of your thigh, is engaged. Your glutes, your butt, are engaged. Your hamstrings, your calves, your hip stabilizers, your core, all of it is working at the same time to keep you in that position. But here's what's unique, because you're standing in a specific posture, your muscles are working at a particular angle. This angle is similar to the angle your legs are in when you get up from a chair. When you climb stairs. When you're standing in line or standing at your kitchen counter cooking. So when you build strength in this position, you're building strength that's directly applicable to the movements you actually do in your life. This is called functional strength, and it's different from the kind of isolated strength you build with machines at a gym. A machine that works your quadriceps in isolation is fine, but it's not preparing your body for the reality of how your legs work together in real situations. With the horse stance, your entire lower body is learning to work as a unit. Your nervous system is learning the pattern. After a few weeks, getting up from a chair becomes easier. Climbing stairs doesn't hurt. Standing through a family gathering doesn't leave your legs exhausted. This is what strength actually means after 50. It's not about looking impressive. It's about maintaining the ability to do the things you want to do. I want you to think about your core for a second. Most people, when they think about core strength, they think about abs. They think about six-pack muscles. This is a fundamental misunderstanding of what your core actually is. Your core is your entire midsection. It includes your rectus abdominis, the six-pack muscle, but it also includes your obliques, the muscles on the sides of your abdomen, your transverse abdominis, the deepest layer, which acts like a natural corset, your erector spinae, your lower back muscles, and your pelvic floor, the muscles underneath that support everything. When you hold the horse stance, all of these muscles are engaged. Not in some abstract way. In a very real, very functional way. Your core has to stabilize your spine. It has to keep you upright. It has to transfer force between your upper body and your lower body. All of this is happening while you're standing still. Research from the Spine Journal found that isometric core training reduced lower back pain by 48% in adults over 50. Not slightly reduced. Cut it in half. But why? Why would just standing there reduce back pain? Lower back pain in people over 50 is often caused by instability. Your core muscles aren't strong enough to properly support your spine through the day. So your lower back compensates, and that compensation creates pain. When you strengthen your core with isometric work, work that teaches your muscles to hold you stable rather than move you, you're actually addressing the root cause of the pain. After a few weeks of daily horse stance practice, most people notice their lower back feels less cranky. Standing feels easier. Bending over to pick something up doesn't send a sharp pain through your back. This is profoundly important because chronic lower back pain is one of the leading causes of disability after 50. Anything that reduces it meaningfully is worth doing. Let me explain what proprioception is, because it's something that matters more after 50 than most people realize. Proprioception is your body's sense of where it is in space. It's why you can close your eyes and touch your nose. It's why you can walk through your house in the dark without bumping into things. It's the communication system between your muscles, your joints, your inner ear, and your brain. When you're younger, this system is constantly being challenged and recalibrated. You're moving in unpredictable ways. You're playing sports. You're doing physical activities. Your proprioceptive system is getting regular workouts. As you age and become more sedentary, this system gets rusty. It's like software that hasn't been updated. It's outdated. And this is a significant factor in falls. When you hold the horse stance, your body is having to make thousands of tiny adjustments to keep you stable. Your muscles are firing slightly different amounts on the left side versus the right side to keep you centered. Your inner ear is signaling your brain about your orientation. Your brain is constantly updating your balance position. In other words, you're updating that proprioceptive software. Research from the Journal of Aging and Physical Activity found that regular isometric balance practice improved stability by 62% in people over 55 and reduced the risk of falls by 43% over a one-year period. This isn't a small benefit. This is literally the difference between independence and dependence at this stage of life. I want to talk about something that matters but that people often don't discuss openly. Sexual function, sexual wellness, sexual vitality, these are part of healthy aging. And after 50, both men and women often experience changes. And most people just accept it as inevitable. It's not inevitable. Often, it's a circulation problem. When you hold the horse stance, blood flow to your pelvic region increases. This is physiological. Your body is working, muscles are contracting, and blood is being directed to those areas. Over time, with consistent practice, this improved circulation has measurable effects. For men, erectile function is fundamentally a circulatory issue. The more robust your blood flow to the pelvic region, the better your erectile function. Research from the International Journal of Impotence Research found that exercise programs that specifically increase pelvic blood flow improved erectile function by up to 40% in men over 50. For women, pelvic floor strength is related to sexual pleasure, comfort, and also to bladder function. The deep muscles that the horse stance engages are directly related to pelvic floor strength. A study in the Journal of Women's Health Physical Therapy found that isometric exercises like this improved pelvic floor strength by 35%. But beyond the mechanics of sexual function, there's something else happening. When you're moving your body intentionally, when you're feeling strong, when you're physically capable, your sexuality improves. You feel more confident. You feel more alive. You feel more like yourself. This isn't separate from the physical benefits. This is part of them. Here's something that most fitness videos completely ignore: what you do physically affects your mind. When you hold the horse stance, especially in the first week or two, your legs will start to shake after 30 or 40 seconds. Your mind will start telling you to stop. Your body will be signaling discomfort. And you have a choice: you can quit, or you can stay. When you choose to stay, something shifts. You're not just building physical strength. You're building mental resilience. You're practicing tolerating discomfort without panicking or giving up. This sounds abstract, but it's actually neurological. When you deliberately stay in a mildly uncomfortable situation and you practice breathing through it, you're actually training your nervous system to be more resilient to stress. Research from psychoneuroendocrinology found that people who practice regular isometric work combined with controlled breathing have 25% lower cortisol levels, the stress hormone, and show 33% improvement in emotional regulation. What does this mean in practical terms? It means you're more patient when stressed. You sleep better. Your anxiety is lower. Your ability to handle life's challenges improves. This carries over. Someone who practices the horse stance daily, who's become comfortable staying in that position even when it's uncomfortable, approaches real-life challenges differently. They're more anchored. They're steadier. This is worth practicing for its own sake, independent of the physical benefits. Your joints after 50 are different than they were at 30. The cartilage, the smooth material covering the ends of your bones, is thinner. It's more worn. The protective fluid that lubricates your joints is less abundant. And inflammation in your joints is higher. Most exercise, especially high-impact or high-repetition exercise, accelerates the wear on your joints. Every time your foot hits the ground while running, you're creating impact. Every time you do a repetitive movement, you're creating friction. The horse stance is different. You're not creating impact. You're not creating friction from repetitive motion. What you are doing is creating gentle, sustained tension in a stable position. This tension actually triggers a process called mechanotransduction. Your joints perceive this sustained gentle load and respond by strengthening the tissues around them. Tendons become stronger. Ligaments become stronger. Even the cartilage itself gets signaled to be more robust. A study in the Journal of Orthopedic Research found that isometric training improved overall joint integrity by 28% and reduced osteoarthritis symptoms by 41% in people over 50. 41%. That's not a small effect. That's a meaningful reduction in joint pain and degradation. What's particularly interesting is that the people in this study continued to have functional joints. They weren't damaging them through the exercise. They were strengthening them. Your hips are your largest and most complex joints. And after 50, most people have tight hips. Why? Sitting. You sit at work, you sit in your car, you sit at home. In this position, your hip flexors are shortened and your hip extensors are stretched. Over years, this creates a pattern. Your hips become restricted. Tight hips have cascading effects. They pull on your lower back, creating pain. They limit how you can move, which means you move less, which means your hips get tighter. It's a downward spiral. When you lower into the horse stance, you're gently opening your hip joints. You're not aggressively stretching. You're not doing something that might injure you. You're gently moving into a position that gradually increases your range of motion. After weeks of practicing this daily, your hips become more mobile. Your morning stiffness decreases. Your ability to move through space with freedom improves. Research from the Journal of Biomechanics found that improved hip mobility reduced lower back pain incidence by 52% and reduced fall risk by 38%. Better hips equals better posture equals better movement equals better everything. Your hormones matter more than you probably realize. After 50, whether you're a man or a woman, your hormonal landscape has shifted. Testosterone is lower, in both men and women. Growth hormone is lower. Your cortisol levels might be higher. Your insulin sensitivity might be declining. Most people just accept this as part of aging. It's not that simple. When you perform exercise, especially isometric work, your body responds hormonally. You're creating a controlled stress signal that tells your body, you're still using these systems. Keep them strong. Keep them vital. Research from the Journal of Clinical Endocrinology found that brief isometric exercises increased growth hormone secretion by 530% in adults over 50. 530%. That's an enormous response from a 2-minute exercise. The same study found that testosterone levels improved by 22% with consistent practice. These hormones matter. Growth hormone is involved in muscle maintenance, bone density, skin quality, and sleep. Testosterone is involved in muscle strength, sexual function, mood, and energy. When these hormones improve, you feel different. You have more energy. You feel more like yourself. You're not fighting against your biology. You're working with it. Your nervous system is the communication system between your brain and your body. When you hold the horse stance, you're creating a situation where your nervous system has to coordinate hundreds of tiny actions simultaneously. Your stabilizer muscles are firing. Your major muscles are contracting. Your balance system is active. Your breathing is controlled. Your brain is integrating all of this information and sending out constant micro-adjustments to keep you stable. Over time, with repetition, this neural pathway becomes more efficient. Your body learns how to do this. Your brain and body are communicating better. This improved communication carries over into how you move through the world. Research from the Journal of Applied Biomechanics found that the horse stance activates over 200 muscles and engages stabilizer muscles that are rarely worked in isolation exercises. This creates comprehensive neuromuscular integration. What this means in real life is that you move better. You're more stable. You're more confident in your body. You recover more quickly from minor stumbles. Your athleticism, even if you don't think of yourself as athletic, improves. This is the benefit that actually matters most, and I mean that seriously. The best exercise program in the world is worthless if you don't do it. And most people don't do complex programs. The horse stance is simple. It's so simple that some people don't believe it can be effective. But that simplicity is the feature, not a bug. You don't need a gym membership. You don't need equipment. You don't need to change your clothes. You don't need to block out large chunks of time. You can do it in your bedroom. You can do it while you're waiting for your coffee. You can do it at work between meetings. Because it's this simple, you'll actually do it. Consistency is the most important variable in fitness after 50. Consistency beats intensity. Consistency beats complexity. Consistency beats everything. Research on exercise adherence shows that simple, time-efficient exercises have 87% higher completion rates than complex gym routines. 87%. This isn't about the horse stance being better than everything. It's about the horse stance being better than the perfect program you won't do. 13 to 1800 hours, Chapter 3, How to Do It, Detailed Instruction. I'm going to walk you through this step by step. Form matters because bad form will hurt you and good form will transform you. Step 1, stand with your feet together, your feet flat on the floor, your arms at your sides. Stand tall. Imagine there's a string attached to the top of your head pulling you upward. That's your posture. Step 2, step your feet apart. I'm not talking about a tiny step. Step out wide. Wider than your shoulders. I'm talking about roughly double shoulder width. Think of it as your feet being about 24 to 30 inches apart if you're average sized. It might feel exaggerated. That's correct. Step 3, turn your toes outward slightly. Not dramatically. We're talking about 15 to 30 degrees. Your feet are still flat. You're not rolling onto the outer edges. Your feet are flat, but your toes are pointing slightly outward. Step 4, this is where the real work begins. You're going to slowly lower your hips downward as if you're sitting back onto an invisible stool behind you. You're not sitting forward. You're not bending at the waist. You're sitting backward and down. How low should you go? If you're just starting, aim for a quarter squat. Your thighs don't need to be parallel to the ground. They don't need to be anywhere close to that. If you're lowering and you feel strain in your knees, you've gone too far. Come back up a few inches. Step 5, as you lower, watch your knees. This is critical. Your knees should track over your toes. They should not cave inward toward each other. If your knees are caving inward, that's dangerous. Your ligaments are in a compromised position. Come back up. Step 6, keep your back straight. Not arched. Not rounded. Straight. Your chest should be lifted. Your shoulders should be back and down, not hunched forward. Step 7, your head is level. Your eyes are looking forward, not down at your legs. A fixed focal point helps with balance. Look at something at eye level, a mark on the wall, a picture, anything, and keep your gaze there. Step 8, your arms can be at your sides or held in front of you at chest height. Both are fine. If you're doing this for the first time, have your hands near something you can grab for balance, a counter, a table, a sturdy chair. Step 9, now comes the breathing. Most people hold their breath when they're working. Don't. Breathe. Breathe in through your nose for about 3 to 4 seconds. Breathe out through your mouth for about 4 to 5 seconds. Slow, controlled, continuous breathing. Step 10, hold the position. Just hold it. Don't think about how long. Don't watch a timer if it makes you anxious. Just breathe and hold. Step 11, When you're done, and you'll know when that is, because your legs will be tired, slowly rise back up. Bring your feet together. Stand for a moment. You might feel a slight shake in your legs. This is normal and healthy. Before you hold the stance, run through this mental checklist. Feet, flat on the ground. Not rolling onto the outer edges. Weight distributed across your entire foot. Knees, aligned with your toes. Not caving inward. Not extending past your toes. Check this in a mirror if you're new to this. Hips, lowered but not too low. You should feel tension in your thighs, not pain in your knees. Spine, neutral. Not excessively arched. Not rounded. Imagine a straight line from your head to your tailbone. Shoulders, back and down. Not hunched toward your ears. Breathing, continuous and controlled. In through the nose, out through the mouth. If any of these are off, stop and adjust. It's better to hold a perfect shallow stance than an imperfect deep one. You're not going to start by holding this for 2 minutes. You're going to build into it. Week 1, hold for 20 to 30 seconds, twice a day. Morning and evening. That's it. Your goal isn't depth or duration this week. Your goal is perfect form. Week 2, hold for 30 to 45 seconds, twice a day. You might start to feel comfortable in the position. That's good. Don't push too hard. Week 3, hold for 45 to 60 seconds, twice a day. By this week, you should notice that your legs aren't shaking as much. You're adapting. Your form is better. Keep going. Week 4, hold for 60 to 90 seconds, twice a day. You're getting close to 2 minutes total. This is a solid foundation. Week 5 and beyond, maintain 1 to 2 minutes, twice a day. This is your maintenance dose. This timeline isn't arbitrary. It's based on how your nervous system and musculature adapt to new stimuli. If you try to progress faster, you risk injury or burnout. If you progress slower, that's fine too. There's no race. You can do this anywhere. Seriously, anywhere. Morning, standing beside your bed before your feet hit the ground. This wakes up your nervous system and sets your body up for the day. Evening, in your bedroom or bathroom before bed. This calms your nervous system and helps prepare you for sleep. Throughout the day, while your coffee brews. During TV commercials. While your phone charges. While waiting for water to boil. These micro-practices add up and make the habit automatic. The key is to find times that are already part of your routine so that the horse stance becomes attached to something you already do. You don't have to add it to your schedule. You just attach it to something existing. 18 to 20 hours, warnings, tracking, and closing. The horse stance is safe, but it's not risk-free. You need to know when to stop or when to see a professional. Talk to your doctor before starting if you have recent knee, hip, or ankle surgery within the past 6 months. Severe osteoarthritis or other significant bone conditions. Uncontrolled high blood pressure. A history of blood clots. Severe balance disorders or vertigo. Stop and see a professional immediately if you experience sharp or shooting pain in your joints. Swelling in your knees or ankles after practice. Chest pain or severe shortness of breath during practice. Persistent dizziness that doesn't resolve. Any injury during practice. The horse stance is preventive, not rehabilitative. If you have an acute injury, work with a healthcare professional first. On day 1, before you start, can you hold proper form? For how long? Even if it's just 15 seconds, write it down. Rate your leg fatigue on a scale of 1 to 10. Note whether you have any knee or hip discomfort. Week 1, focus on form, not duration. After each practice, notice how your legs feel. Do they feel different the next morning? Week 2, you should be able to hold longer now. How much longer? Week 3, test your baseline again. Can you hold significantly longer than week 1? Week 4 and beyond, track overall improvements. Energy levels. How stairs feel. How getting up from a chair feels. Joint comfort. Your sense of balance and stability. The most powerful tracking tool, take a 10-second video on day 1 of you doing the stance. Take another video on day 30. You'll see the difference visually, better posture, more stability, more confidence. I want to come back to something fundamental. This works because it aligns with how your body actually works after 50. It doesn't fight against your aging. It doesn't try to make you 25 again. It works with where you are and builds from there. It's sustainable because it's simple. Because it fits into your life. Because it doesn't require you to be someone you're not. And it's effective because it's based on actual neuromuscular adaptation, not hype or false promises. In 30 days of consistent practice, most people notice easier movement overall. Less joint discomfort. Better balance and confidence. More energy. Better sleep. A sense of feeling more like themselves. These aren't coincidences. These are the documented effects of daily isometric practice. So here's where we are. I've given you the science. I've given you the exact method. I've given you the timeline. Everything you need is in this video. What you do with it is your choice. You can continue as you have been. No judgment. Many people will. Or you can try something different. You can give this 30 days. 2 minutes a day. In your living room or bedroom or kitchen. No equipment. No cost. If in 30 days you feel no different, you can stop. No harm done. You lost nothing but 2 minutes per day. But my guess is that if you do this consistently, you'll feel different. You'll move different. You'll feel stronger. You'll feel more like yourself. And that's the real point of all of this. Aging doesn't have to mean weakness. It doesn't have to mean pain. It doesn't have to mean loss of independence. It can mean moving smarter. Building differently. Maintaining what matters. The horse stance is one tool for that. If this resonates with you, subscribe. Next week we're talking about the 5-minute morning routine that Japanese centenarians use for mental clarity. Not clickbait. Real practices with real benefits. Drop a comment if you're going to try this. Tell me what you experience. I read every comment. And most importantly, stand up right now. Go find a quiet space. Try the stance for just 30 seconds. Let your body remember what it's capable of. The power of stillness is waiting for you. All you have to do is take a stance.